Lethal means objects that can be used to cause self-directed violence are at the heart of conversation this Suicide Prevention Month, with the focus on safety and the power of knowledge to save lives. Leading that conversation is Kayla Arellano, Technical Assistant Coordinator at the Guam Behavioral Health and Wellness Center.
When we think of lethal means safety, we're trying to put more time and distance between a person with thoughts of suicide and a lethal mean.
On Tuesday, mental health providers and community members gathered at Jibwick for a lethal means safety training, a workshop created with Guam's unique needs in mind, with a special focus on ligature safety. Ligatures such as ropes, belts, or cables are the most common items used in hanging, which has been the leading method of suicide on island for the past decade. Data shows hanging accounts for 82% of suicide deaths here, a stark contrast to mainland patterns where firearms are the most common method. Christiana Santos Whitman, Project Director of Guam Focus on Life under Jibwick's Suicide Prevention Branch, explained why it was so important to design this training locally.
But it was really developed locally because we want to arm our community members with skills to help people to stay safe. We kind of spent a lot of time, we meaning my team, spent a lot of time really on this workshop developing it to kind of give it a local flair and to ensure that it speaks to the needs of our local community. And so while we do want to think about firearm safety and medication safety, and that's also included in this workshop, we do want to spend a lot of time on how can we keep ourselves safer at home, from some of these everyday objects that we use that are useful. But when someone is at risk for suicide or when someone's having a mental health crisis, we want to be a little bit more prepared, or we want to have these healthier conversations to allow them to keep themselves safe from these things.
The training emphasized practical steps, building safety into everyday spaces, reducing or removing access to lethal means, or replacing them with safer alternatives. The message was clear: knowledge is a powerful tool for prevention. And beyond safety, the workshop addressed stigma, helping professionals, families, and friends learn how to have difficult conversations with care and compassion.
Would it be alright if we look at some of the ways to make lethal means harder to reach at home, so it'd be safer if you're ever in a crisis? Remember that this isn't a really one-and-done situation. This is something that we're going to build on and nurture. We're continuing to deepen our relationship and acknowledging again that we are safe spaces and we are here to support.
At its core, the training also centering human connection and dignity.
They might also be suppressing any of the invitations. They might be feeling ashamed of what they're experiencing, so they're hiding away. So there's a very harmful loop happening. We tend to have a very vertical relationship as providers and clients or patients, where we want to ask them to do A, B, or C to stay safe. But healing cannot really happen vertically. It can only happen when we have a collaborative and equal relationship. So we want to ask them and treat them as another human, just asking like, how can I best support you and what do you need most?
And with that, a final reminder: there is always hope, help, and resources, and safety begins with connection.
Although we might be the first people in our spaces to talk about suicide, we don't have to be the only ones. And I'd like to share 988.
If you or someone you know is struggling, help is just 3 numbers away. Call, text, or chat the Suicide and Crisis Lifeline at 988. Free, confidential, and available 24/7.